I'm Jules, and welcome to Write, Submit, Succeed, a Nurses podcast. This is where we help nurses share their expertise and their experiences through publication. So whether you're new to publishing and writing, it's your first article, or whether you've published before, we're here to make the whole process a lot less intimidating.
I'm Sherry, and today's topic is one of the questions we hear most often from nurses. I want to write, but I don't know what to write about. So please note that this is a very, very common question, and developing the topic focus really does take some effort and more time than you might think.
Exactly. So many nurses assume they need groundbreaking research study or a completely unique idea before they can publish anything, but often the best topics are already sitting right in front of you in your everyday practice.
So in this episode, we'll help you identify potential writing topics, explore ways to uncover your expertise, and discuss how a simple literature review can help turn an idea into a publishable manuscript. Let's start with a misconception, though. Many nurses think I'm not an expert or I don't have anything new to say.
Yeah, because expertise isn't always about being nationally known or conducting research. Expertise can come from solving problems, improving care processes, teaching others, successfully navigating a challenging clinical situation. So think about your daily work. Have you helped implement a new protocol? Have you developed a patient education strategy? Have you improved communication during handoff? Have you found a solution to a recurring problem?
Those experiences may not seem remarkable to you because you live them every day, but to nurses in other settings, your insights can be incredibly valuable. One of my favorite questions to ask prospective authors is, what have you improved, changed, or questioned in your practice?
Oh, that's a great question. That's often where great article ideas start. So maybe in your unit, you've reduced falls. Maybe you've improved discharge education. Maybe you've noticed a gap in practice and worked with your team to address it. Another useful question might be, what frustrates you?
That's right. Sometimes the challenges we encounter point directly to topics that need discussion. If you're struggling with an issue, chances are other nurses are too. Another question that I think helps in this, refine this focus is, what do colleagues come to you for advice about?
Yeah, maybe you're the person. You're the person everyone asks about wound care. You're the person everybody asks about diabetes education or precepting new nurses or managing difficult conversations or even using a new technology. If your colleagues are constantly seeking your guidance, you've identified an area where you probably have a lot of practical expertise, and that's often the foundation for an excellent manuscript.
You can also think about presentations you've done. Have you educated staff, led an in-service, presented a poster, or did a presentation at a conference? Those presentations often contain the framework for a publishable article. Much of the work is already done. You simply need to adapt it for a manuscript audience. And be careful if you do so. You do want to source your presentation or your poster and include it in your references as a citation.
Very true. Another place to find ideas is by paying attention to recurring questions from patients or families. If patients are repeatedly struggling to understand a condition, a treatment, a self-management strategy, any of these things, it may indicate an educational topic worth writing about.
And also think about newer nurses. What concepts do they find difficult on your unit? What clinical situations require extra coaching? The goal isn't necessarily to discover something entirely new. Sometimes it's about explaining a complex topic clearly and helping nurses apply evidence in practice.
Yeah, and once you've identified a possible topic, the next step is conducting I'm going to say it, Sherry, a literature review. So don't let, yeah, so many people. So don't let that term intimidate you. A literature review doesn't mean you're conducting some major research project, so don't back away from it.
Right. Think of it as exploring what's already been published on your topic. Start by searching nursing and healthcare databases, of course, professional journals, and evidence-based resources. And as you review the literature, ask yourself a few questions. What's already been written? What recommendations are supported by evidence? Are there gaps or unanswered questions? Has anything changed recently in practice guidelines or standards? That's always a great topic for a new article in the literature. And I also encourage authors to look in the medical and lay literature for insights on the topic, just to get insights from other fields and areas and what they're talking about related to that topic. I like to print, I know I'm old school, I like to print the content out and read it multiple times. I saturate myself in the topic so that when I sit down to write the concepts and connect it to real life cases, the work seems easier because I know the literature so well.
Yeah. No, that's great advice. And remember, the literature review is going to serve like two important purposes. First, it's going to help you ensure your article reflects current evidence. That is super, super, super important. Secondly, so many first-time authors will choose a topic that's too broad. And a literature review will help you refine the focus. For example, if you begin with a broad topic like, I don't know, preventing sepsis, for example, your literature review can help you reveal more specific angles, like early recognition, nurse-driven screening tools, or post-sepsis recovery. Because the bottom line is, narrower topics are easier to write, easier to review, and more useful to readers in the long run to apply to practice. So use the literature review to refine your topic.
And in that literature review, you'll sometimes discover that the topic hasn't been covered extensively. That's okay. Mm-hmm. You may identify a unique practice perspective or a new application that adds value.
And then once you've selected the topic, you've reviewed the literature, ask yourself one final question. What is the practical takeaway for readers? Because editors, as in Sherry and I, and probably most editors, they're always looking for articles that answer the question, how does this help nurses in practice? So how do you find the answer to that? Well, you send a topic query to the editor. This is just a short email with a topic draft title, with some bullet points covering the topic you're considering. So it's really a great idea to run the idea past the editor to get feedback before writing 2,000 plus words. The editor might be able to share additional insights on what you should consider when covering that specific topic. Also, if you're ever stuck choosing between several potential topics, maybe pay attention to which one energizes you and interests you the most. You're likely going to spend several weeks researching, writing, revising, so a topic that you're genuinely curious about is much easier to sustain than one that you think you should write.
That's true. I think if you have passion about the topic, it makes it a little bit easier. And you want to focus on what readers can do differently after reading your article. Jules mentioned the takeaways. What actions can nurses take after they read your article? What lessons can they apply? How can they implement a practice change you've described? How can they make it happen? So, I'm thinking here about how to talk to your leadership about implementing the practice change that you see recommended in that you're writing about. A strong manuscript combines the evidence with that practical application. It helps readers understand not only what the evidence says, but how to use it in real world clinical settings. So that's that takeaway that we're looking for in those articles.
So true, so true. And if you take away just one thing from today's episode, I hope it is this, that you probably already have a topic worth writing about. So if you think about it, your daily nursing experiences, quality improvement efforts, patient care challenges, teaching moments, clinical expertise, all of these have the potential to become a valuable article. And here's a pro tip for you. Maybe start an article ideas file on your phone or computer. So every time you encounter a clinical challenge, answer a frequently asked question, learn a new skill, participate in a quality improvement initiative, learn something new, whatever, jot it down. Most authors don't necessarily struggle with a lack of ideas. They struggle because they don't capture them when they occur. So then they go looking for them when they want to write something. So you will be surprised over the next few weeks when you start your article ideas. You'll be surprised by how many potential topics you've collected.
And start by asking yourself, what have I improved, changed, questioned, or learned recently?
Yeah.
That can help you with your literature review and narrow your focus and think about the practical message that you want to share. Jules, we have a nurse reader who wrote to us. Tanya Salabi is an RN case manager in Fallbrook, California. And Tanya asked, do you have workshops or a community of nurses that support each other? I'm currently in a writers group, a critique group, and a great community of all kinds of writers that are very supportive. Is there anything that you specifically know about for nurse writers to join? So thank you for your question, Tanya. On our webpage on myamericannurse.com at Write, Submit, Succeed, we do have a list of resources for nurses. It's not that long, but on that list you'll find a link to, it's called Writers Camp, and it's an online resource for nurses started by a group that Jules and I are involved with called the International Association of Nurse Editors, or NAIN for short. And in this writers camp, they include resources for nurses, and they're building an online community for nurses interested in writing. So I would recommend you check out our links to resources on our page and that writing group page as well, called Writers Camp. And before you go, we want to let all of our listeners know we're asking you to consider writing for American Nurse Journal. Please consider sharing your clinical expertise with nurses across the country through American Nurse Journal. We're looking for manuscripts, and we're especially interested in clinical feature articles, although we're interested in contributors to all of our content areas. Our clinical features help nurses better understand challenging assessment findings, complex conditions, and emerging clinical topics while providing practical guidance that they can apply in everyday practice. So the manuscripts we're looking for are between about 1,200 and 3,300 words. That's excluding references. Successful submissions include a brief anatomy and physiology overview that does not have to be in depth at all. But we want you to include a clear application to practice, as we've talked about in these sessions, and nursing implications that readers can translate into their work in patient care.
And if you're considering a topic, think about what nurses need to know, what challenges they face, and how your expertise can improve patient outcomes. If you're not sure how to organize the article, that's okay. We offer several format options. So take a look at several recent issues of American Nurse Journal to get some ideas. So you could consider frequently asked questions format, with questions serving as subheads to engage the reader and address common clinical concerns. Or you could consider like a case study approach, introducing the topic through a patient scenario and concluding with outcomes. Case studies are pretty popular, and they help bring clinical concepts to life and demonstrate their real-world application. So whether you are an experienced author, or writing your first manuscript, we encourage you to submit your work. To learn more and review our author guidelines, visit myamericannurse.com. Look for our new podcast on writing for publication called Write, Submit, Succeed, which is also at myamericannurse.com. We look forward to reading your manuscript and helping you share your knowledge with the nursing profession. Thank you for joining Write, Submit, Succeed, a Nurses Podcast.
We hope you'll join us next time as we continue helping nurses turn their knowledge and experiences into published work. Until next time, keep writing, keep sharing, and keep succeeding. Thank you.
Yep.